Hi, it's Dr. Donna. Now that you've seen the first video of how you do the cardio smart, what is heart failure? Next step I jump into is the American Heart Association Rise Above Heart Failure. And it too is a marvelous one-page. It's the self-check plan for heart failure management, because the truth about our lives, we've got to equip these people to manage this chronic disease by themselves. Heart failure is not a cold. It is something they will live with and learn to manage. And that's our job, to help them be successful. You can see that there is a green zone, a yellow zone, and a red zone. I don't care how you approach this, but I've just talked to them about all the causes and symptoms and what heart failure is. I jump into the red zone. And I pretty much say, well, I look at this page as if it were a stoplight. Green light, caution light, red light, and that red zone stopped your life. Heart failure stopped your life. It made you have to come to the hospital. And they'll agree. And the other reason why I like the red zone is because it's got a couple more little icons that tell you what the patient may have experienced. Dry, frequent, hacky cough. Yeah, that's from the extra fluid overload that's in those alveoli. Shortness of breath without exerting yourself, just sitting, you can get short of breath. They can relate to that. The increased discomfort and swelling in the lower body. And then sudden weight gain, more than 2 to 3 pounds or 5 pounds in a period of a week. They can come in and they can be so dizzy and so confused and sad and depressed. Now, believe it or not, some men and women lose their appetite because of all the swelling and all the fluid. They feel full. They'll describe it as bloated. And then here's another icon that's really good for you to be looking at and letting them take a look at this. Increased trouble sleeping, they can't lie flat. So they're laying in bed, they jump up, they've got to get up, they sleep in the recliner, and they may have been sleeping in the recliner for a couple days. And you go, whoa, okay. So, red zone. I never want you in it again. You did the right thing. You came in, you got help. That's what you do when you're in the red zone. But let's work on keeping you out of the red zone. Let's go to the green. So here you've got, again, very familiar little icons that they are going to get used to seeing and they'll be able to relate to. I don't want you to have shortness of breath. I want you to do the physical activity that you're used to. And at that point, I ask them, what is your normal? What is normal physical activity for you? Because I want to know. And some of them go to the gym, some of them walk, some of them garden, and a lot of men love to mow. They don't want to quit mowing, they're going to mow. So whatever is normal for them. And I don't want them to be swollen. I want their weight pretty much stable. And I definitely don't want them having any chest pain. And so underneath there's a bar that says, good job, great, let's do this. Daily weight checks. There are weight sheets. They can use a notebook. They can use a calendar. I don't care what they use. You can provide them with weight sheets. I'm sure that you can find some. What else? Meds. Whoa, that's going to be a real amazing session when we talk about the heart failure drugs. But they need to know about their medicines. Why? Well, you know, I asked them a few things in the green zone. Can you afford them? And that is not a time for anybody to feel embarrassed, and I tell them that as well. Everybody knows how expensive medications are. Can you afford your drugs? Is it easy for you to get them? And if they tell me yes or whatever, if you have a medication assistance program, which most hospitals and organizations do, we know that we're going to need to set them up with them. So the other thing is, okay, you can get them. Do you remember to take them? That's a very important piece of the puzzle, because if they're not swallowing the pills, how are we trying to keep those fluids off if they don't know? And a lot of them don't. They don't know what their meds are. And we do change them a lot. Low sodium diet. There will be a wonderful session on divorcing the salt shaker, because that's something that they're going to have to learn to do. And at this point, just telling them low sodium diet, whoa, you might get some expressions. I love the salt shaker. Okay. Follow-up visits. Do you have trouble with transportation? Are you able to get follow-up visits? Are you able to keep them? And you get to find a lot of information about your patients again as you're looking through all this. And then I go to the caution zone, and that's where you really have to do some psychological communication, because you see a lot of our patients are 60, 70, 80, and 90, and they don't want to go to the doctor, and they don't want to go to the hospital, and they don't want to bother anybody because, you know what, they're sicker people than me. I don't want to go there. I'll wait. I had one patient, Donna, I had an appointment next month. I was waiting. You're waiting. 20 pounds up and you were waiting. So we have to make them have an understanding that, you know, when you first see any sign, and that's one of the times that you can really start honing in on the importance of daily weight. And it tells you here, 2 different places, the parameters for weight. If you're watching your weight and you have to find out, do they have a scale? And are they using the scale? And there you have, okay, if you're gaining 2 to 3 pounds, what in the world is 2 or 3 pounds? Well, that can't be that much. And a lot of people think that that is food gain. You have eaten too much food, and so you've gained your weight. And you have to let them know that quick water weight gain is fluid. And it'll show up on the scales before you can't sleep laying down. If you can get used to everyday habit, jump up, get out of bed, go to the bathroom, get on the scale with the same clothes on or off, whichever you choose. Habit. Write it down. And then watch it and track it. And so when you think about a liter bag of fluid, which all of us nurses know, a liter bag of fluid, well, what is that? 1,000 milliliters, and it weighs 2.2 pounds. So if you can take that imagery to your patients and let them know, if you were hauling, you know, 2 or 3 of these liters all around in your tissue, don't you think that would make you tired? But if you saw it on the scale, what would you do? I want you to call the doctor. I want you to call your nurse practitioner. I want you to call and let them know your weight is up. And here's what you can expect. You can expect them to say, I want you to take an extra fluid pill. Diuretic, Lasix, furosemide, torsemide, Bumex, whatever they know the words to be that are equivalent to their water pill. Had a lady say, oh, Donna, that's my pee pill. Okay, if that's what you want to call it, that's what we'll call it. So you always use their terminology because you want to have them have a source of memory. So we don't want them shortness of breath when they're doing the dishes or trying to walk the dog. We don't want them uncomfortable. We don't want them having any problem. We don't want them living in a recliner. So caution zone they need to call. And that's what I tell them. Caution, call. And be prepared for medication change. And all of that information is right there on one page. And this is American Heart Association, Rise Above Heart Failure. And there's a toolkit if you get on that website for professionals. And I have found it's really good. I pulled it out just this week, was talking to a patient, and she said, we have that up on our refrigerator. Good place, because every day this can be your assessment tool. A very good way to learn what is important, what you have to teach your patients, what we have to help them with the management that they have to do. It is a partnership. We can teach them, but they have got to put it into practice. And when they do, we really need to give them the kudos that they need, that they are doing a good job. And that's where we want them, in the green zone. Excellent. Keep up the good work. And so I hope this helps, and I thank you for your time. Till next time.